Wonderful. Okay, so that I think that the technology's worked out, and now I have 6:17 on the
Okay, so please.
5th of October.
Okay,
This is going to be the Board of Health meeting for this month. I would ask all participants that wish to speak at the public input portion to put their own systems on mute until we get to the public input, just to make sure that we can actually hear each other, don't have background noises, etc. And with that, I think our first motion is going to be to approve the minutes. And I will ask the board members if they have any comments or questions or corrections to make.
Yes, I was talked with Don earlier today. One of the sections in the motions in regards to, it says, I think it's on the second page, in regards to accepting for water treatment plants, and it really probably should be clarified to be wastewater treatment plants.
Okay.
Okay. Other than that, everything's fine. The idea is that what we were talking about in regards to, the treatment plants, any new development and whatever is that it's wastewater, not potentially a treatment plant for some water supply. Yeah.
Under old business, it's the 5th paragraph. It's the last 4 words. We just want to insert the word wastewater to clarify that. And the only thing there was that I think we had talked about the DEP Zone 2s, and
right.
That's separately in the next paragraph. So it's my first read. I was a little bit worried about that, but I clarified.
Yep.
Anne Marie, do you have any concerns?
None at all.
Wonderful. I will. If someone wants to make a motion.
I'll make a motion to accept the minutes from the last meeting.
Richard, do I hear a second?
Second.
All in favor?
Aye.
Approved unanimously. Next, we have the incoming business. So if we had any other animal bites at the dog park and people giving out false information with regard to the dog's name and phone number?
No. Nope.
I don't think we've had any real problems.
No, we haven't actually.
Yeah.
This was interesting when this one came through.
And there's no chance that there was a photograph or other description beyond the medium-sized white with brown spots.
I do have a note here, I think it's on yours as well, that Animal Control Officer Mark had said that it was negative for rabies and that up to date on shots, but I'm not sure. Donna, do you know which animal he was referring to on that one?
Yeah, excuse me. Michelle actually spoke with Mark, but she did find out it was the animal that I believe was the one that bit the other dog.
Okay.
Okay.
Michelle, am I correct on that? You have to go to the top to hit unmute.
Yes. Okay. All right. Yeah.
Okay. So we have a proper identification for the dog that bit.
Correct.
Okay.
Mark had found out all the information and was able to investigate it properly. And it's a closed case at this point.
Okay, wonderful. I was afraid that we were going to have to start figuring out ways to identify if this dog comes back. So, any other questions about incoming business?
No?
No questions.
If anybody wants to make a motion,
I'll make a motion to accept all incoming.
I'll second that.
all in favor?
Aye.
Aye.
Okay. Next is our old business.
So the first item under old business is the COVID updates. So just to give you a brief update on where we're at. The office continues to get complaints regularly around COVID. We are seeing our cases increase, particularly over the last couple of weeks. For the month of September, we did have 33 complaints related to COVID.
How many?
33.
33.
Yeah. In addition to that, we are on the Mass Department of Public Health chart. We are in the yellow still. Basically, that is the chart that they go by. They look at the previous 2 weeks of cases per 100,000 population, and they give each community a color. We were in the green for a little bit. We've been in the yellow now for a couple of weeks, which means that we have between 4 and 8 cases daily per 100,000 population. If you go above the 8, then we turn into red, I'm sorry. So that is updated every Wednesday. It will be updated again this next Wednesday. Just from the calls that we've been getting coming in, just from what we've had reported on Maven, we are definitely seeing an increase in our numbers. School has been in session for a little over 2 weeks now. They started, their first official day was September 16th, but that was a Wednesday and that was full remote. And the way that they're doing it is they have 2 cohorts. One group goes to school on Monday, Tuesday. The other goes to school on Thursday, Friday. They're all remote on Wednesdays. They're only in school for the half day, and then they're remote in the afternoon. We have had a confirmed case at Harrington, 3 confirmed cases at the high school, and a confirmed case at the South Row that was not involving a student, that was actually involving a student teacher. As of today, our numbers are 462 confirmed cases of COVID, 42 probable cases of COVID, for a total of 504. We've had 46 deaths. We were actually holding quite a bit for quite some time at 44, and that just went up to 46. And we have 37 active cases on the books. We do update these numbers weekly on our website, but it's done weekly on a Thursday. So if somebody were to look at the numbers I just gave you today, compare them to last Thursday, they're going to be different because we just checked this morning. So this was effective as of this morning. I did have a conversation with someone who works at Lowell General last week, and they also confirmed that they were a little concerned that they're seeing some numbers go up again. So, in addition to that, last week, the governor announced that effective today, if your community was in the green or the yellow, that businesses could graduate, if you will, to the second half of phase 2, which increased like indoor dining from parties of 6 to parties of 10. It allows them to use the bar area for extended seating, not as a bar to serve alcohol across the counter, but as an extended seating area. They've also extended the outdoor seating further into the season so that now people could bring in heaters, and then they would actually also be putting down the sides of the tents, obviously for heat. And they still have to, maintain the social distancing and the barriers and the mask wearing, except when you're at your table. The nightmare that we're going to be facing, however, is if your community goes into the red for 3 consecutive weeks in a row, then you have to go backwards and you have to go back to phase, step 1 of phase 1. And, if that were to happen, logistically, how that would be enforced, how that would be tracked, I can't even begin to imagine, because it's just going to really be the onus of the businesses to know that. And the only way that we're going to know that they're not doing it properly is when we get the complaints, which we get on a daily basis. So, Dr. Miko, do you have any other updates from like Lowell General and stuff?
I think Lowell General, that the numbers had been in the single digits for a good long while, and for about the last month or two that they've been creeping up towards the teens, but they've been staying in the teens. It hasn't been like it's been a continued rise over that time. The number of people on ventilators is far down from where it was in the spring. And in part, that's also because they've sort of changed the approach so that they have other therapies to start early in the course, and they're trying to not use the ventilators as quickly. The ER's experience, I can't remember if I said this last month, but it has been the spread is more community acquired in the sense that it's not really clusters where they have easily identifiable sources, but people who just sort of randomly picked it up and had a fever. I was going to ask, has that been the experience in Chelmsford as well?
Yes, it has.
Okay. And so that it's, I think that the state as a whole is still down about 0.9% positivity amongst the tests. Mm-hmm. And that puts us in the range, because if we get up towards 4%, then we have to shut down the schools and stuff. So it's a slight rise from like 0.8 where it was.
Can't hear you.
It was 0.8 a couple of weeks ago, and it's risen up to the 0.9% for positivity, but it's still staying in a good range. With regard specifically to the situation, the cases at the high school, everything's secure with our ability to test the people exposed?
Yes.
Okay.
Yes. So that's working out very well. Once someone is identified, if it's a student that's identified, we work very closely with the school principal, the head school nurse, identify, what their schedule was, what their classes look like, and trace whoever should be identified as a close contact at that point. And then the school is the one that notifies you, the school is the one that notifies the parents of the students that they need to be in quarantine. What we do at the health department is we determine the dates of isolation and quarantine. So isolation for the student, quarantine for all the close contacts. Once we contact the case, we get all of the information that we need. We come up with those specific dates and we relay those dates to the school. And then the school sends out the notifications to the parents. And they don't just notify the parents of the students who are quarantined. They send out different letters. So you get one letter if you're identified as a student who needs to be in quarantine with all the specifics, what the dates are, what quarantine is, and then those people actually go to remote learning. And then the parents of all of the other students in the other cohort get notified that there was a case, but this is what we're doing accordingly to follow up on that case. And then as far as if there are any staff members who are identified as close contacts that need to be tested, arrangements are made, and we're we track the testing on those staff members. The good news, which I'm thrilled with, is that they're following policy and procedure. They're wearing the mask. The teachers are wearing their masks. They're staying within the distances that are required. And we, knock on wood, have not had a single staff member test positive.
Yay.
So that's good news.
We've had a problem in the office with, number one, the expectation for a lot of people who are diagnosed is that, that are exposed, is that if they test negative, they can go back and do whatever they want. So we've had some resistance to that. And the second thing is for families who live in the same house, if they don't figure out how to separate from one another, they're a little bit frustrated by the fact that they're 14 days after their last exposure to somebody who is positive.
Yes.
And then once in a blue moon, we have somebody who, especially if a grandparent is going for a procedure after having COVID-19, sometimes the hospital or the surgery center will automatically test them again, and they'll turn positive, and the whole family goes nuts trying to figure out what to do about that. And if it's within 90 days, then infectious disease just says they should not have been tested and ignores the result at that point.
Yes.
So, okay. Any other questions people have regarding COVID-19?
No.
No, nothing. That.
Sue, I have a question.
Yeah.
So they're starting to put up these big tents at the restaurants where they've been doing the outside dining. How is that different from being inside?
So now that the sides of the tents are down, it really isn't any
Right.
different from being inside.
Right.
So they have to go by the same guidelines as the inside. So there's not it doesn't have to do with maximum capacity now. It has to do with the distancing and the barriers.
And do the restaurants know that?
They should. And trust me, if somebody goes and they go out to eat and they're not doing it, we get the phone call.
Okay. Yeah, it just seems like what's the difference?
Right. And that's exactly it. And the thing is, because their capacity indoors is limited because of the distancing, I think that's why the state said, to help these businesses out, to try to extend the outdoor seating even further and allow them to put the signs down in the tent, allow them to bring in the heaters. And I know for the town of Chelmsford, when you do bring in the heaters and stuff like that, there is a fire department permit that you have to get and stuff like that. And the town has agreed to waive those fees for those inspections so that people can, can do it and extend their season. They still have to file for the permit, but there's no fee.
And what's the situation with, these small sub shop type places? I mean, I've gotten in the last couple of weeks, I've had people come back and say to me that the staff is not masked, not using gloves or anything. What are they supposed to be doing?
So they are supposed to be using gloves. They are supposed to be wearing masks. The issue is, and we've had some of these complaints, where there are certain people who are working, whether it maybe is could be a cashier, a checkout person, whatever that might be, related to a food service. And there are some people who are out there and they are working and they have a medical condition that prevents them from wearing a mask.
So entire sub shop hire people with medical conditions?
Well, they shouldn't. I mean, but I'm just saying, we do have people out there where we have followed up on complaints, and specific, not everybody. No, not everybody. And if we walk in and an entire shop has, is not wearing masks and they're not doing things properly, we will. Basically, we're going in there, we're telling them who we are, we're giving them a copy of the state requirements, we're telling them that they need to come in compliance, and this is what you need to do to follow the DPH guidance, and then we follow up with them as well. And if we have repeated visits and people continue to be non-compliant, then we will go further up, we will fine them, or we will go further up and we'll involve the Attorney General's office.
Okay. Thank you.
Yep. Any other questions?
No, we're good.
Okay. So for Newport Industries, I managed to get the DEP approval letter, which goes back to 2011 on Newport Industries. And, you know, there's a lot of, you know, legal information and all that, but we did end up having Westford forward that to us, which is why I wanted to include it in the packet. We continue to have complaints of odor around Newport Industries. We continue to send all of those complaints to Ed Brazick at DEP. I know that the Westford Health Director, as well as the Environmental Health Director in Westford, are also sending any complaints that they get to DEP. In September, we had 23 complaints about Newport Industries as far as odor, and we were out there several different times. The Westford air quality study was completed. I don't know the exact dates of when they did their air quality study, but what I do know is that the health director in Westford just received the results from the air quality study that they did in Westford. They have not gotten the final report yet. GZA is compiling that final report, and the plan is that on October 19th at the Westford Board of Health meeting, GZA is going to present the results of the Westford study to the Westford Board of Health. I did hear, and I haven't seen, like I said, I haven't seen that full study, but I did hear that, interestingly enough, when they picked their spots to do the air quality study in Westford, the residents at the time really wanted to concentrate on the schools and, you know, the proximity to the plant. And there really aren't any schools that are real close to that plant. There's that one that's further down off of Route 40. So I don't really know where they did all the other air quality in Westford other than around the schools. Chelmsford has completed their testing, and they sampled between 9/16 and 9/24. I did put that email in your packet, so it says specifically what was done on each date. And I know that we have people on this call who are interested in this. So 9/16, it was Ledge Road. The 17th, Scotty Hollow. 18th, Lovett Lane. The 21st, Chelmsford Woods condominiums. 22nd, Chelmsford Commons manufactured home community on New Yorker Avenue. 23rd, Lady Slipper Lane, and the 24th on Chamberlain Road. They said that the results from our study, and everything was done from 0700 to 1600. They expect the report to be approximately 3 to 4 weeks. Once the report is completed, they will present that report to the select board. And obviously we will get the final results report. We'll put it on our website. It'll be on the town website. And GZA had reached out to Westford, and they told the environmental health director in Westford that once both reports were completed, if either town wanted them to do a compare and contrast, they would present that data to us. So that's where we're at as far as that air quality testing.
Yeah, Sue, I have a question. Did the testing time frames that they were doing the testing, did it match up with the existing contracts that are occurring at the two facilities, so that we're not missing any of the time frame that they might be putting out asphalt outside those hours that they were testing? Do we know that?
What I do know is that GZA was given a full folder, if you will, of all of the complaints that we had received, particularly from around Newport and that area, as far as the complaints and all the specific areas where we were getting the complaints. And we asked them specifically to pay very close attention to those areas when they were doing testing. So they had all of those complaints and that information. And I'm trying to reference the dates in that email with looking at the calendar. So it does not, so the 19th and the 20th was a weekend. So they did not test on the weekend. They tested during the week.
Yeah. No, because I saw that thing with Mark saying that they had some new contracts, and that again, most of the contracts seem to be usually highway stuff and whatever. It seemed to run late at night and whatever, and I just sounds like the time frames that they checked didn't really match up with, well, potentially. The answer is I don't know, but I guess that's a concern. That are we catching their real operational things?
My understanding was that the contracts were with aggregate.
Okay,
but
good.
I could be wrong about that, Rich. But that was my understanding.
Okay. Yeah, no. And that if that's true, then that's good, because at least we have a pretty good handle on the activity of aggregate versus if there was any new contracts or whatever for the Newport ones. Okay. That's good. Thank you.
Okay.
Thanks.
Any more discussion on old business?
Well, we didn't get everything that we wanted on the sewer,
No,
if I'm correct on that, Sue, right?
right.
We didn't get a hard moratorium.
No, it was a soft moratorium. And then if you want to look at the warrant articles, so the select board is meeting tonight as well. And of course, they're going to be voting on these warrant articles. And what you see in your packet is the final warrant article going forward as far as the sewer capacity. So the first one, 18, talks about, if the town will agree to spend some money on a study. And then, of course, 19 has to do with the fact that what we had said before was that everybody had to tie in, and that would now change.
Mm-hmm.
What was their reasoning for this soft moratorium? Did they say?
Mostly because they want to be able to, they're hoping that they can go back to the table with the Lowell wastewater treatment plant and see exactly where, like, Lowell is, Drake it is, have a meeting and find out where they are at as far as capacity. And I think the hope is that maybe there is some capacity that Chelmsford might be able to tap in to get more. And then also to kind of figure out from if the town is going to give an okay to do this study to determine options, other options of increasing capacity.
So when I'm looking at this Article 19 with what's underlined, it talks about the Department of Public Works, that a connection to the public sewer is reasonably available. I don't think that was our language.
Not exactly.
Right, because that is really squishy language.
And
Okay,
That's a good term.
that's language that lets the DPW take care of their friends. Not that I think they would, but that is really not good language. I mean, other than that, reasonably, how is that? That's not even defined anywhere here. And it goes on. It says it a couple of times. I mean, I don't know who wrote that, and I don't know whether they realize how squishy that language is, that language is going to be impossible to defend against or promote. It's just a lawsuit waiting to happen,
and so
in my opinion.
I think the understanding too is that, as a health board, we could go forward at town meeting and make further comments. It was explained to me that the intention of this verbiage is that it still ultimately lays in the hands of the Board of Health, because we are the enforcing agent, and where the sewer division and the Department of Public Works comes in is basically them being the informant to us of, yes, there is in fact a connection for somebody to tie in, and or there is in fact adequate sewer capacity for someone to be able to tie in, or no, they're more than 300 feet from a property, which of course is the exorbitant, cost. So that was the understanding, the way that it was explained to me.
What is the, excuse me, I'm sorry. What's the upcoming date of town meeting?
The first date, let me just look at my calendar here. October 19th.
Okay, yeah, that was my guess if I was gonna. Because the bottom line is that they come up with this soft thing, but if they miss town meeting, then what? Then what kind of time frame is it before they can come back potentially and do something firmer, if you want to call it that, whatever. I mean, the idea of giving yourself a window. I mean, if they were going to town meeting and saying we want a moratorium, and yes, it's effective September 15th, it's effective October 19th, whatever the particular date is, at least they should have the tool for the town meeting to sit there and say, hey, if you don't get your something together, then guess what? We're going to need to take the hard line versus the soft line. But this seems to just be kicking it down the road to what date?
Well, the end date of this moratorium that they wrote is October 31st of 2021. And the reason they did it that way, instead of just doing, a year from September 15th to September 15th, they essentially did it to the end of October so that it would
at least,
go beyond town meeting of next year.
But if they pass town meeting, if they, don't have anything really there, then what can they do in between then and spring? I mean, it's like, geez, if you're going to have a moratorium, have it. I mean, there's a lot on the table with this whole sewer thing, as far as, what's coming down the pike, what we're going to be faced with as far as, contractors, our capacity, regulations that we have on the books that we, we're not going to, we can't talk about tonight, but we'll, right.
We have to adjust those. We'll look at those next month. There's a lot of things that we're going to have to take into account moving forward.
Well, I personally do not like the repeated use of reasonably in Article 19. I think it's like a get out of jail card.
Mm-hmm.
I agree. I think it's really too open, I guess if you want to call it.
Right. It's open to interpretation. Either way, it's open to interpretation.
Right.
And we're going to be stuck with their interpretation. We're going to have to live with their interpretation.
Right.
So I don't know how that got thrown in there.
So I think our only opportunity is to bring it forward to the floor at town meeting.
Okay.
Eric, what are your thoughts?
Sorry, I got a phone call, so I blipped out there for a moment. What was the question?
Reading Article 19, it talks about the sewer division of the Department of Public Works determining that public sewer is reasonably available.
Oh, I don't like
The
the word,
argument,
I don't like the word reasonably. I'm trying to go through the rest of it to sort of figure out if, as determined by the Board of Health towards the end of it, means that DEP Zone 2 and our other requests, and who is determining reasonably? Is this
the sewer division.
the sewer division, that they're the ones that determine it? Why isn't it kicked to us to define it?
Well, I think they have to determine whether there's sewer capacity, and they can determine whether or not there's an infrastructure within 30 feet, 300 yards or whatever, but determining reasonable availability doesn't make any sense.
Right, but you just said that you don't need the word reasonably in there, that you could tell me what it is without putting that word in there. So where is this at right now?
This is the proposal that's going to go before town meeting.
And when is town
Being
meeting?
voted on tonight by the selectmen, correct?
I'd rather just take out the word
Yeah.
reasonably on everything.
Yeah.
Yeah, in two places.
Yes, I'd love to take out the word reasonably here, in each usage.
Well, do we want to do some sort of a motion, Eric? I mean, it's probably too late to get something before the select board tonight, unless they're listening to us.
Do you know, what time are they meeting? Do we know, Sue?
I think the meeting starts at 7.
Their meeting starts at 7? 5 minutes?
Yeah.
So, and is it the kind of thing that we could actually write something or say something at town meeting and ask that can they amend it then?
Yes, because it has to be voted on town meeting floor. So
Mhm.
the Board of Health could submit. My understanding is that town meeting, Rich, you may know this better than I do. I think they could submit a proposal to change the language, or simply,
Yeah.
if your proposal is to delete the word reasonably in those two sections, you could do that. I don't know as far as they're having a Zoom meeting tonight as well. You can jump onto the select board meeting by Zoom tonight, and I believe that once they get to that section, you could comment on that.
You can comment during that or during open?
I believe during that section.
Okay. And to back up, in terms of why they chose the words reasonably there, and mind you, Rich might be able to speak more eloquently about this, but they put reasonably in because if there is absolute, if they have 3 drops left, they might want to keep it in reserve, or the problem is it just makes it a judgment on somebody's part.
Right.
Exactly.
Right. And like you said, the concept of the town is really getting tight on the numbers to the point where we don't have any buffer, whatever the appropriate term is, reserved capacity in case of a problem, kind of thing. I think they're really pushing it, and just like you said, it's going to be a decision based on I don't know what. I really don't.
Can we make an argument against having taking the words reasonably out and having it be an absolute? Or is there a better way of defining so that it's not left to the judge. It's not so subjective.
Well, it seems to me it's either available or it's not available. Go ahead, Rich.
Yeah. No. I mean, the obvious thing is that I'm trying to think back at the report that came in from the consultants, Weston Sampson, in regards to, what do they believe is a reasonable, buffer, cushion, what reserve that we should always have in place in case of, kind of thing, versus, if someone sat there and said in reasonable means that we still have a, some kind of percentage number or some kind of gallonage number, then that at least might give you something to go by. But I can't say I remember what the report said about what was left. And of course, the obvious problem is that they kind of made list of what they thought was going to go forward because of where things stood and which ones weren't going to potentially go forward. And that's a crapshoot and a half.
So
that's a real crap.
I think that, potentially, I think with how long our meetings usually last, I think when we finish this meeting, if someone wanted to jump on the select board meeting, I believe that these are the last two articles for the warrant articles for our town meeting, Article 18 and 19. So I think that prior to them voting on accepting, comments could be made tonight on their meeting. I don't have the link to their meeting. I'm sure it's on the town website.
And my only problem right now is that as I'm rereading this, I don't know that taking the word reasonably out of those two spots and having it be an absolute, that if there's a drop left, you use a drop. Because the discussions were that, that they wanted to keep enough reserve in that people with existing homes who were putting on a mother-in-law unit or something that they could potentially tie in, that they left a little bit, but there's not a, that I can think of off the top of my head here, an eloquent way to say that. In other words, that you should be able to have an objective criterion so people aren't treated, differently from one another. You should be able to treat everybody the same. But to say that you're going to, reserve, 1% or 0.1% or whatever else, I don't know that I have a way of saying that.
Well, it does say, Eric, that a connection to the public sewer, if you get rid of reasonably, is available, taking into account whether sufficient sewer capacity exists.
Well, there's another squishy word for you. I could argue that either way.
So
I just want to let you know that Pete put the link to the select board's meeting on our chat. So if you just click on the bottom, you can see that.
Okay.
And you can certainly cut and paste that after, or I can send it to you.
Okay. But again, when we talked about this last month, we talked about it at the joint meeting, actually, with the various boards together. We said that there was like some factor there that they wanted to kind of hold available for existing residential units to be able to sort of tie in if they had, more, if they needed to have more capacity from those. And if it's an absolute with no definition, then they don't have words here to say they're going to give preferential to existing residential. They don't have any words here. But if you take it out, then you can't accommodate for those.
Yeah, it's again, as I said, Anne Marie is more on the legal ease, and she's not happy with the fact that they've kind of, the truck can go through the hole kind of thing that they've done, which I guess gives them some flexibility. But I think if they tied it to the report or something like that, where at least there was some reference to the reasons why they were going to wanted to, that kind of buffer for, you know, for those things, then that'd be one thing, but they're not. They're just throwing very loose language in there to.
And you're talking about the future report that if they have an assessment for what the options are, or which report?
No, I'm talking about the report that they already have put out, where they're basically sitting there saying, you know, we're definitely getting very quickly, and with what's on the board will totally disappear. Any buffer, you know, cushion, whatever the appropriate term that you're going to use, is just going to disappear. And if this goes forward and goes from this town meeting into next town meeting, and a certain number of decisions are made, I think we're going to be in a bigger bind. And you know, the idea of studying all the things and the directions and whatever, but I think we all have the big problem with the fact is that I don't see this some magic bullet in a short time frame that's going to be coming from Lowell that's all of a sudden going to create capacity for us.
So do you have,
Say,
sorry, Eric, go ahead.
you go ahead.
I was just going to say, do you have specific recommendations for, you know, changing this wording that potentially you could vote on, and then if somebody is available to jump on to the select board meeting and present that to them tonight?
I don't know that we want to define that. I think that our main opposition is to the squishy wording. We want the word reasonably taken out. And if they have that as a hard and fast, or if they want to reference some other report, but they should have something that's a little bit concrete, a little bit, you know, more equitable between people as opposed to being a subjective determination. So in terms of how to say that in a motion that we can vote on, and I can say it a little bit at their meeting, the Board of Health is opposed to the subjective word reasonably used twice in Article 19, and would rather that it was either removed out altogether or a more objective phrase or reference to another report could be used. Somebody help me end that one.
Yeah, I think that's about the best that we can do at this point in time. And at least we're not potentially walking into town meeting having to argue over, I mean, that's going to be a great thing as I mean, to be arguing the word reasonably on town meeting floor that we don't agree, and 20 other people get up, and, you know, it could be the entire night, you know, kind of thing. I mean, I think what we're saying is it's a little bit too open-ended to be bringing to a town meeting, and that you either got to have something that's reasonable and sit there and saying and refer to the report saying that we're going to keep this kind of buffer right now, you know, kind of thing. I think is the best that we can do right now. I mean, I think town meetings is another option depending on what they do tonight. But I think informing them that we're not happy with, and I don't care if you use the word squishy or not, it doesn't.
I wouldn't.
You know, I mean, if you want, you can say I said it. You know, I mean, I'm not worried about that. But yeah, I think you're on the right track in that we just need to, and again, without getting into a big brouhaha over it, just sit there and say, hey, you know, we saw your warrant article, but geez, that's the best you could do with wording. You can't define it a little bit better than that, you know, reasonably in two places kind of thing.
Okay. So
it just seems to me that
go ahead.
sewer capacity is either available or it's not available.
I agree.
But at that meeting, they said that the intent was that of the remaining, and I'm going to botch the numbers now, 40 or whatever, that a certain amount of that had already been sort of spoken for,
right.
And that a certain amount, like 10,000, was left over, and that they wanted to kind of keep that as a buffer for existing residential structures that were going to otherwise, make minor changes that would increase the volume from those. And the idea is that they don't want to, if somebody happens to put in, a commercial project and there's a drop left, they don't want the last drop and then nothing whatsoever to be left over tomorrow for a choice to use a different way.
Yep.
So,
I mean, you could say that a connection to the public sewer is available in taking into account sufficient sewer capacity exists for the property under consideration. I mean, I think that's really what I'm hearing you say. If we have a certain property that needs to connect to the sewer, do we have sufficient capacity, or do we have the capacity to connect it to the sewer? We might have capacity for a single-family home, but not for a 3-family home.
Right.
I mean, we could rewrite this whole thing, and I'm not going to do that. I mean, my complaint is that
Right.
word.
So what I've written down for my currently is Board of Health is opposed to the subjective term reasonably used twice and would recommend either to remove, define, or to reference objective criterion elsewhere.
Yes.
Agreed.
I think that's, yes.
Perfect.
I agree.
I agree. Good luck.
So if that's again, we'll take a vote. Aye.
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 Okay. So I'll try to log into the Board of Selectmen and see if I can figure out when to say that part.
Okay.
So,
Thank you, Eric.
Otherwise, any other comments, concerns with regard to the old business?
None from me.
No, nothing from me.
I'll take a motion to accept.
So moved.
Second.
Favor? Aye.
Aye.
And now we're on to new business.
Okay.
So Sue, I want to talk about the permitting fees, particularly as they have to do with these businesses that are really being hurt here. The food establishments, the daycares.
So we actually, the only thing on the agenda tonight is to talk about the fees that relate to sewer.
Okay.
So if we want to discuss the other ones that we had approved
Put
last
it on
year.
for next month, yeah.
Okay, all right. So for tonight, we can only discuss the sewer ones. And what happened was right after the moratorium went into effect, less than a week later, I had received an email. And what is this? Request recording permission from the meeting host?
What?
I just thought something popped up that said, please request recording permission. I don't think that had to do with me. Anyway, so what happened was I got a request from an engineer who's working with a homeowner about the possibility of pursuing subdividing a piece of property. And that engineer wanted to know what the next steps would be as far as going forward with soil testing and perk testing. And immediately, of course, that brought to light that we haven't done this in, I've been in public health for 20 years. We haven't done it in all those years. And we needed to go back and take a look at what we had for fees. And then on top of that, what our staff capacity is at the current time, which we've discussed in the past. Our staff capacity is not adequate to be doing these types of inspections. So in the very little amount of time that we had available, we took what was on our books for many, many years on this list for fees. And we reached out North Andover because Michelle had originally come from North Andover. Michelle is, as we know, Title V certified. And then Westford is completely septic, but all of their septic stuff is done by Ray Dick, who is their in-house environmental director. She does everything. So they have one, a specific person to do that. So we looked at our fees, we compared the fees of the other communities, and then basically in working very closely with Michelle, came up with recommendations for what the fees would be. The second page, as far as the septic construction, are the fees where at the top of the page, those are things that for the most part, we would not be doing as health department staff, and we would be subcontracting out. Michelle, we got contracts from, we got summaries from Mill River Consultant and Northeast Classic Engineering. And of course, they each presented their information in a different way. So we have to kind of gauge what each of them gave us. And what we do know is that with Mill River Consultant, I know you look at the first fee and you say, oh my goodness, that's a lot, but that includes all of the deep holes for any type of potential construction. And it's the soil testing from the beginning. And then they basically charge for each of these fees, and those are their fees that they would charge the health department. And then if you look further on the bottom, and you'll see the stars next to the bottom of the bed, the tank inspection, and the construction inspection, final grade, those are all absolutely necessary inspections that have to be done on any single system that is put in. Michelle is able to do those 3 inspections as far as under her certification, okay? Right. So that's why if you look on the page before, that's why we lumped all of those together on line 8, tank, B&B, and final grade inspection, and put the one price of $150. But we also want to keep it as that line item, even though, Michelle may do it, because if she's away, if she's on vacation, if she's at capacity, if we have to hire it out, then that's what we have to charge for someone else to do it. And then I did include the 2 proposals that we got from Mill River and Northeast Classic. And I know that based on reviewing both of them, Michelle's recommendation would be Mill River. She's had a lot of experience in working with them in the past. And she said they're very thorough.
Is that $700 per hour or $700 per project?
That's the project.
Okay.
Yeah,
The thing is, it might be 3 or 4 deep holes. It could be 8 or 9.
But we're not saying that we would be committed to Mill River. I mean, you're not asking us to choose. If their fees are the same, can't we have them both in the stable?
I don't see why we couldn't.
I mean, I just don't know why we would not have 2 people, 2 options there.
Mm-hmm.
I mean, all things being equal.
And the thing is, because we were so limited on time, like I said, only because of how busy the office is in general, and trying to do, just COVID and then have this on top of it, we could also go back to Northeast because they didn't give us the whole specific. We could ask for the line item costs as well, so that we have both, like you said, both in the stable, but costs for each line item. Because the individual that's doing the work is going to pay the fee. They're going to have to pay the fee for that cost.
Right.
So essentially what we're asking from the board is approval of the recommended fees, and then approval of the fees given by the two different consultants with the stipulation that we go back to Northeast and ask them to break it down a little bit further. Rich, were you going to say something?
Yeah, no, just basically that I looked at the fee schedules and, the cost of all the different things and the inspections and whatever. And yeah, the numbers are reasonable for what's out there and what's being done. As I spoke to Michelle today, is the fact that, with the way our regs are being stricter than have additional regs added to the Title V thing, that I think it's going to be a little bit more, quote unquote, expensive, potentially, depending on, what and where they are, these particular projects. I mean, I think we've taken a stand in regards to those that are in our groundwater protection kind of areas, that certain things need to be done, and that a subsurface discharge of any form, whether it's treated or not treated, because part of our original regs back in the 80s basically was that we had the option, the Board of Health had the option to require additional treatment on any discharge of anything built in town. And we sort of put that all in play for the fact that, the future was unclear at that point where the town of Chelmsford would be. I mean, in the 80s, we were basically looking at the scenario of 60% plus 65% of the town being sewered, and we were still going to have at least a third of the town on septic, and we needed to do and keep stricter scenarios, potentially stricter scenarios in certain parts of town in play to protect the groundwater for those areas that were never going to be sewered. Then bang, in 96, first of all, the code changed and made it even more expensive and more for septic. But then the sewer expansion, the next phase of sewer, which said, oh, we're going to do 100% of the town. So the regs that we have basically on the books still are the board's option to deal with. And I think, number one, that depending on where these requests are coming from, and that's totally out of the blue of where they could be, but the fact is that they're going to be potentially more expensive under our scenario, not what their individual companies are going to charge for doing different components of it. That part is there. But I think the review of additional treatment is something that what I call parties that we're going to hire, do they have the expertise to review treatment added on to this discharge that's going to the ground? And that might be another piece that we might need to sort of, and I'll sit down with Michelle and whatever, talk about, and you so about, again, what the options are. Not the board. The board has a lot of flexibility on what they're going to do with this. And of course, the flexibility was, hey, our real solution was 100% sewer, and then we were going to be out of the business. Was basically the solution that we were going for, and that nothing was being discharged to the ground anymore, to the groundwater anymore, and therefore any forms of pollution weren't going to be of risk to our groundwaters for the future. Now this change is opening that can of worms up again, and it may not turn out to be that significant on numbers and whatever kind of thing, but I think there's potential of a little bit more expense on the inspection on the consultant side, about that they're going to be not going to be reviewing just standard, what I call boilerplate septic systems put in the ground, what I call pipe and gravel and stone, but there's going to be different levels potentially of secondary treatment that are going to have to be added to it too. And they need to be capable of kind of reviewing that information for us too, not just straight septic.
Are these things that we would need to account for in our own fees, and that we should put this on hold until we consider it more? Or should we accept the fees as written and then make amendments for other services at, say, our next meeting?
Well, I think we could vote on the straight fees, because we're only going to we would probably be looking for someone with a higher level of expertise that has an engineer involved on their side that would be able to review some of the, what I call the treatment things that are potentially out there. So again, it's going to go into the ground, and you need to be able to inspect what's there and how it was installed and constructed and whatever. That part isn't going to change no matter what. The question is, what levels of pre-treatment or treatment potentially will you do beforehand? And that, of course, on a large, huge project, of course, it'd be a treatment plant. Okay, but someone to review the treatment plant data, which, again, I'm not saying these individuals don't have the capacity to do that, but I'm just saying I think they need to know that this is not going to be just a bunch of standardized septic systems, thrown on the ground.
So for tonight, you need to have the fees approved by the board, the ones that are type of permit marked in red on the fee schedule. And we have the comparisons in the other surrounding communities. And for tonight, you need us to approve the two contractors. Is that correct?
Yeah, so I would ask that you approve the recommended fee schedule. And then if you notice, let's see, if you go down on the permit fee schedule under submission, I just want to take note where it says installer's application extension 1 year max. We're proposing.
Are you talking?
So on the page of all the fees, not the two contractors, the other one.
Okay.
And
which one?
if you look at line 16, it says installer application extension, 1 year max. We're proposing no extension because a year is pretty long time already.
Mm-hmm.
And Anne Marie said she lost sound again. Anne Marie, are you back? She can't hear us.
Yeah,
She's got to log back in, I think. So,
Okay.
So my recommendation is, my request is that you approve the recommendation of all of the fees under that column recommendation for Chelmsford Board of Health fees, and that you approve the two consultants that we got pricing from, and we will reach out to that Northeast Classic to get further information. We really didn't give them a whole lot of time to give us
right
a lot of details.
Okay.
And again, I think with the two consultants, the idea is that I think we need to get them looking at quote unquote the fact of, is some of this stuff that's going to be coming through, what they're going to be reviewing has treatment components to it. Would that or would that not affect what they've given us?
Yep.
I
guess we'll have to see. Anne Marie, can you hear us now? Can you hear us, Anne Marie?
Can you hear us?
Oh, no.
You're on mute.
Anne Marie?
Oh, you're on mute. Up, here you go.
I'm back. I couldn't hear you again.
Okay. Okay, so what we need to vote on, Anne Marie, is number one, the fees, number two, the contractors, and then number three, that Sue's going to reach out to Northeast Classic in particular and define some of those the other values there. So with regard to the fee schedule, do I need a motion and second?
I'll make the motion.
Yeah, no, I'll second it for the fees. Yes.
All in favor?
Aye.
Aye. Okay, and we need to approve the 2 vendors. Is that correct, Sue?
Yes, I think so.
Okay. So
I mean,
I'll take a motion to approve.
Yeah, I mean, I think we can approve them for the limits of what they're saying they're going to do for the money, but I think we need to look into whether there's other charges for things if there's treatment in the packages that are going to come forward.
So we're gonna define those other parameters.
Right, right.
But with regard to Mill River Consultant and Northeast Classic Engineering, I'll take a motion to approve them.
So moved.
I'll second that. Yep.
Good.
Second.
All in favor?
Aye.
Okay.
Thank you.
Okay. And does that then complete new business?
I believe so. I have nothing else.
If there's no other discussion, I'll take a motion to accept.
Motion to accept new business?
I'll second that.
All in favor? Aye.
Aye.
And now we have other.
Busy bees, that's what they call it.
Well, I think what's really remarkable is how much of our staff's time is spent enforcing the COVID regulations, which sadly, at this point, everybody should know them. I mean, you can see this one about the supermarket where the assistant manager says, oh, he just took off his mask for a breather.
Mm-hmm.
You don't take off your mask for a breather. It's like, what are they thinking? But it's a lot of part-time that we have other things. We're going into flu season right now. We have other things that really need our attention without people not understanding the need for a mask and that they shouldn't be taking it off just arbitrarily because they choose to do it at that point. So, I mean, that's just a little aggravating when you see what we're using our time for.
I agree, Emery, because the staff is at 150%.
Absolutely.
From me right on down. I'm going to admit it's very trying. Very trying.
Right. These are ridiculous things. This is something, we've been in this now for 8-9 months. This is something that our businesses should know.
I agree.
And the fact that maybe we need to do a new fee. Maybe we need a fee every time we go out to one of these businesses to tell them to wear their masks. I mean, maybe that's
a lot of money.
Yeah, maybe
a lot of money.
Yeah, maybe then they would enforce their staff. I mean, I don't know what they think this is. I'm very frustrated by it.
Yeah. Well, I think that might be something we talk about on fees next month.
Yeah, maybe we do. No, honest to God.
Yeah, I know you wouldn't think about it, but yeah.
Yeah, I mean, not that the fees help our bottom line anyhow, but somehow it would be a deterrent.
Right.
And then you got the problem with, if we're not out there reminding them of what they have to do, and I saw this myself in Westford, in Whole Foods. If we're not doing it, one of the other residents is going to do it. And then we're going to have a confrontation between residents. And, we don't need that kind of activity going on either.
Yeah.
Well, we would find the establishment, which means we would be putting them in the role of their own police person, which is what they're supposed to do in the first place.
Exactly.
I'm a little bit dismayed because the conversations I've been having I've been bumping into a lot of resistance, families, parents not wanting to vaccinate their children against the flu, and already saying that they've got opposition, that they don't want to do experiments on their child. when the COVID vaccine comes out. And I've always been worried because I think the kids, adolescents in particular, are the reservoir that's going to sort of sit in. And we're going to have a lot of, I'm just worried, the more resistance, the more problems we're going to have. So
Good point.
is this something that we want to put on the agenda for next month to consider fees for establishments if we hear a complaint and have to go out to them?
Well, let's revisit it next month. I mean, now that we've gone public with it, maybe we'll see some improvement. But if we don't see any improvement, I believe that's what we have to do.
Mm-hmm.
Sue, in the current times, is the state, I mean, I know they've, put up some funding towards different things for COVID and whatever. Are they starting to see the consequences? That's, never mind the shortcomings of local health, staff wise and whatever, but the fact that, the funding that they've given so far, is there a new round of funding? They talk about a new round of funding for everything else.
So
Is there anything else there?
we actually just found out that they are going to give us about, I want to say it was $3,800 towards supplies for increasing our flu clinic capacity, not COVID related, but flu clinics, in order to help with the increased mandate that all students have to be vaccinated in order to be in school by December 31st. As far as COVID monies, there is actually an HMCC meeting tomorrow. And I know that that topic is going to be brought up as to whether or not there is going to be more funding. I also, have had the discussion with Paul Cohen about the CARES Act money, and that is specific to COVID, and it covers a lot of different realms in relation to COVID. And I have started the conversation about the possibility of trying to hire another employee for the health department because we're drowning. We just absolutely need more help, and we're working through the weekends, and it's just, we can't sustain it. We can't sustain it.
Do you need clerical help or do you need medical help, professional help?
Right now, I could use two people. I could use someone to do enforcement out there in the community, and I could also do another nurse to follow up on just cases and contacts. The issue is they still have the ability for us to send some of our cases to the contact tracing collaborative, but I have collaborated with my other colleagues, and anybody who has sent any cases to the CTC has informed us that they don't really get the information that they need. They don't get the feedback that they need. They don't know where they're at within the community. So how does that help us within our own community if we don't get that feedback? And it's not a good timing as far as turnaround. So we're better off having someone work specifically with our office.
Mm-hmm.
So that's my ultimate goal right now.
I agree.
So hopefully they'll send, more funding, because clearly I don't have it in our budget. I don't have any room for any overtime in our budget. Mm-hmm. And we don't get, we're not, most everybody in my department is not union. So we're not subject to, overtime pay and stuff like that. So.
Right.
So that's where we're at.
All right.
And we do have, we have started planning flu clinics. We have them advertised out there. We're doing our over 65. We're going to be doing our first ever drive-through clinics. First one is October. Oh, Donna, help me. I'm going blank. October 20th. October 20th. And So we are having people pre-register for that. I have reached out to the middle schools and the high school because we've always done school-based flu clinics.
Right.
That principals there are still interested in collaborating with us despite the craziness of their schedule in addition to the craziness of our schedule. So we are going to try to do something like that. Right now, I don't know when I'm getting my state supplied vaccines, so none of that can be planned until such time as I know when I'm getting that.
Have you been getting the volume of vaccines that you've requested from the state?
I haven't gotten anything from the state yet.
And the reason I ask is that where we asked for 200, we got 90 in our first order.
Wow.
Oh, wow.
And right now there is no, the state will supply up till, like, for children up until their 18th year, and that goes up to their 19th birthday. After that, we have to pay for flu vaccine privately to give to children, adults who are 19 and older. And there is nothing left out there. There's not the typical vaccine. There's something that costs about 10 times or about 8 times more that is, has no egg in it. But what's out there has been purchased, and it's limited. And I'm a little bit nervous about whether or not we're going to be able to vaccinate all of our kids who are in schools. And so I was just wondering if there's a buffer, if the health department was expecting more to vaccinate kids.
I requested 500 doses of state supply. I've been approved 500. I don't know when it's coming.
Okay.
And then private supply, which again, like you just said, is, 19 and older. We purchased 500 doses of high dose for 65 and older. And we purchased 500 doses of the quadrivalent, for all of the others. And, that's our typical every year. And of course, we placed that order like last year. It's renewed. So like we're in the same situation that you are, in the sense that I don't think once we go through that, we're not going to be able to order more.
Mm-hmm.
Yeah.
Okay. Any other discussion on the other section?
Nope.
And if not, I'll take a motion to accept.
So moved.
Second.
All in favor?
Aye.
Aye. I think, by the way, that next month we're going to have Rich do the motions. And,
I know.
and it does get predictable. You know who to look at. That said, I think that we're going to open up the meeting to public input. Donna, can you unmute, or if people want to unmute who care to speak? And is there a mechanism? We had something the other day that at a different meeting that you could raise your hand. So yeah, on Zoom, if you click on the more, it has chat, meeting settings, etc. And the next to a bottom one is raise hand. So if somebody from the community wants to, I would ask that you raise your hand so that Donna can identify you. Donna, can you?
Yeah, I don't see anybody raising their hand at this point, but we do have 3 people on from the public. If any one of you want to speak, you can unmute, and then I'll call upon each one separately.
So if you unmute, Donna can see that it's the little red icon has gone off, and then she'll call on you.
People could also post.
We have, sorry, go ahead, Sue.
I was just going to say, somebody could also post in the chat that they would like to speak.
We actually have Jonathan, who has unmuted. Jonathan, you can take the floor.
Hello, Jonathan Lina from D8 Scotty Hollow. So the air quality report, once that's ready in 3 weeks, how do you get a copy of that?
That will be posted on our website as soon as we get it. So if you don't know how to get to it, you just go to the Board of Health website, Town of Chelmsford website, and click on Board of Health. and we will upload it to our page.
Okay, thank you.
You're welcome.
Thank you. An easy one. I'm looking across. Lisa Politano, guest 2, or actually, those are the 3 people.
Yes, 12.
If Lisa or guest 12 wants to speak, you can just unmute. Okay, I think we're,
Okay.
Okay.
Does anybody else have anything else that they want to say tonight?
No?
Specifically
Adjourn.
with regard to public input, then I'm going to close public input. Our next meeting is going to be November 2nd, 2020. I believe, Sue and Donna, that it will be doing using the same Zoom format, but that we're hoping that for us at least, that we'll have a room and we'll be able to use Zoom in December to engage the community as well. Is that correct?
That's the ultimate goal. And I just want to say thank you very much. I appreciate your support. I don't know that people realize just how hard the health department is working and the strain. I think people do understand, but at the same time, you know, it's still every day the same thing over and over. And I'm going to tell you, when you walk in my office, you would never know it by my staff. They just keep on plugging and they're working their buns off. So I do appreciate you acknowledging how hard we are working.
Absolutely.
Well, we appreciate you.
Not.
And we are glad you have a good team with good attitudes. That said, if there's no other discussion, I'll take a motion to adjourn.
Motion to adjourn?
Second.
And after a vote, I'm going to go over to the Board of Selectmen. So all in favor?
Aye.
Dr. Meikle, I will email you the link right now.
Okay, I think I just copied it from the chat.
You did?
And
Okay.
I just put that in the browser and I don't know, whatever this in the web.
Yeah, you can, but I also have it in email form and I can send it to you. It might be easier that way.
Send me that way. Click on it directly. Thank you.